Welcome to another edition of Health Department Roundtable. I'm your host and current board member, Chris Schultz, and with me today is our newest Board of Health member, Melissa Pond. Welcome, Melissa.
Thanks for having me, Chris.
Great to have you aboard. So I'm going to give a quick update. I know it's been a couple of weeks since we've had a new episode up, and I'm happy to report that we still have nothing to report in Abington. Our numbers are at zero, which is a good accomplishment. I do just want to, on behalf of the health department, remind people that we are still in the midst of a pandemic. If you haven't been vaccinated yet, please call the health department or go online to mass.gov and check for vaccination sites. They're readily available. And in fact, you can enter to win $1 million if you're vaccinated. So please do that. So one of the things that we're doing now that we're sort of moving out of the emergency mode is I wanted to take a chance to interview the various members of the Board of Health and get to know them a little better. So today we're welcoming, as I mentioned, Melissa, who's our newest member. She was just appointed to the board a few weeks ago. And due to our reduced summer schedule, you haven't had the opportunity to actually attend a Board of Health meeting as a member yet, but that is changing next week. So, Melissa, I want to ask you first, what do you do for a living?
Sure. So I work for the City of Quincy Planning Department as I'm currently a senior principal planner. I started there as an intern in 2007, and I've moved up along the way and doing lots of different things. And then about 3 years ago, I started getting a passion for the cross-section between health and planning and got involved with a number of different organizations, including the Blue Hills Community Health Network Alliance and BID Milton Hospital and South Shore Health, and participating in advising in those capacities. And then that led to me running for the Board of Health here in Abington.
Awesome. Yeah, because that was my next question. What made you decide to run for the Board of Health, which up until the last year or so has really been one of the more overlooked boards in town. So what attracted you to our little board?
Yeah, I really wanted to be able to pull up a seat to the table. I do a lot of work in government in Quincy, like I was saying, and wanting to be able to collaborate here in my own hometown.
Awesome. I know you have an agenda item coming up on a meeting next week. I want to be careful about what we discuss because even though there's only two of us, we are both on the board and there's open meeting laws. So in a more general way, I'll ask, what are some of the things that you would like to see happen or bring to the table as a member of the Board of Health?
I'm really excited to hit the ground running this week and bringing an agenda item, like you mentioned. I have the mental health first aid training under my belt. I've done it twice. It's good for 3 years. So that's why I've done it twice already. And I'm hoping to bring that here to Abington. And so I have the two trainers that I last trained with work for Plymouth County Suicide Prevention, and they can work with us. And so bringing that to the table at the next board meeting and seeing what we can do.
Excellent. For those viewers who are interested in the next Board of Health meeting, we're meeting this Monday. The date escapes me. Is it the 12th?
Yes.
Yes, Monday the 12th. We're doing a virtual meeting because our chair and myself will both be down at Camp Squano, summer camp with our troop. So we'll be doing a Zoom session, and I believe it's not being broadcast live. So if there's anybody out there watching or listening that would like to attend the meeting or participate live, we'll have that information available for you to join the Zoom session. You can check our social media page on Facebook, Abington Mass Board of Health, for any updates. So Melissa, in a more general way, tell us a little bit about yourself. What would you like to share with the Abington public about Melissa?
So I'm here in Abington, obviously, and we've been here for just 3 years. Excited to be part of this community. I have a 5-year-old girl and my husband, and that's pretty much my life. Working full time, being part of boards. I also teach at 2 Christian higher education institutions virtually. And so that's all a really big part of my life.
Excellent. And the one question I've asked our members so far, what's your favorite album?
Ooh, favorite album? That's a really good question. I'm just gonna be a little silly here and say the Beatles because I know that was big during the campaign season for for our friends running for the Board of Selectmen.
Excellent. Is your favorite Beatles song or one that you maybe not favorite, but one in particular that you like?
I don't know.
I was going to put you on the spot and ask you who your favorite Beatle is, but that could lead to a whole sidebar discussion. So, all right. Well, that's pretty much all we have this week. As we mentioned, Melissa has an item that she's bringing to the agenda next week. We also, I believe, will be discussing donation bin regulations, which we had brought up before and just had to have town council look at that. So we'll be discussing that as well, and an update on any of our COVID or vaccination efforts here in town. So that's all for now. Melissa, thank you very much for joining us today.
Sure.
Now that Elsa has moved herself out of the way, hopefully we'll have a nice weekend. And we will be back next time, hopefully, with Kevin is the only member we haven't talked to yet here. And as always, if there's a particular issue or concern that you'd like addressed here on our roundtable, please contact us either through the town website, the Board of Health link, my email's on there, or if you're on Facebook, you can contact me through the either Abington CAM or the Abington Mass Board of Health pages. So until next time, stay healthy, and thank you for joining us. Thank you, Melissa. Thank you, Kevin.